Representative Hamadeh, you are recognized for 7 minutes.
Thank you. Thank you, Mr. Chairman, and Secretary Collins. It's good to have you here.
And I believe happy birthday.
Thank you, it is. I've turned 68 today. I'm just doubling my age so I can fit in with my other colleagues over here.
Well, that's it for me, Mr. Chairman. I'm gone.
As we all know, the number of veterans in America has declined over the past 2 decades. Yet VA spending continues to skyrocket, and this trend is simply unsustainable. Now, Mr. Secretary, under your leadership, the VA is finally taking long overdue steps to increase accountability, eliminate waste, and refocus the department's mission of serving veterans and not preserving bureaucracy for bureaucracy's sake. Now, as my Democrat colleagues fearmonger, the reality is more than 300,000 jobs have been exempted from the hiring freeze. The focus is on eliminating the administrative fat, not doctors and nurses. Veterans need the VA bureaucracy to work for them, not the other way around. It should not have taken the VA's chief financial officer 2 weeks to give a simple set of basic budget accounting information to you, but that is what we had until recently. With more than 60 disparate HR systems, outrageous tales of corruption, and chronically broken veterans integrated services networks, we have lacked fiscal accountability for decades. Now, Phoenix's Carl Hayden VA Medical Center, which is quite infamous, failed so many veterans that it became ground zero for reform efforts. And I know there's been a lot of progress being made over there. But veterans in my district and across Arizona expect the VA's budget to directly support their care, not layers of administrators removed from the mission. I look forward to assisting your continued efforts to refocus the VA on its high-minded mission, taking care of veterans. The Trump administration's reforms aspire to accomplish this by providing greater oversight, less bureaucracy, and a culture of nonstop effectiveness. Now, Mr. Secretary, we've heard a lot of scare tactics, but I want you to talk about, once more, list the services and jobs excluded from the hiring freeze.
Thank you for offering the question. And one of the things is, there's something you said in your question that I want to address if I could, and I'll get to that part. You talked about our chief financial officer. I wish I had one right now. Right now, our chief financial officer, our lead general counsel, and our national cemeteries undersecretary are being held up in the Senate. These are 3 veterans who have all served. One who is going to be Sam Brown, who is going to be head of our mortuary affairs, our cemeteries, gave some of his own body to service of this country after being blown up, and yet is right now being held hostage in the United States Senate by the same people who actually want to say, we want you to hire veterans and not fire veterans. Well, now I just got a sense, and I've told the senators this as well, it's time to stop that. If you want to hire veterans, and I got 3 of them that need to be approved and need to get on the job working for veterans. So when you say I have a CFO, I don't have one because I can't get the Senate to approve them. So don't tell me they want to help veterans when they got 3 of them sitting right there, one who was grievously injured in wartime that they refused to approve. That's what I'm dealing with right now. In addition to what you're saying and what we're looking at, we're not looking at doctors, we're not looking at nurses, we're not looking at this, and you just look at the numbers in general, and you have your poster there. I mean, we're looking at issues that I talked about earlier, where we have payroll that is being done at 60 locations, which was supposed to have been centralized a long time ago with hundreds of employees that we're now having to look to see how we can consolidate to make sure we're running it efficiently and more cost effective. We don't need them all over the place. We don't need the issues that we have of human resources being run in every location, again, with hundreds of employees. We have a system of a VISN system, which many of you may understand was put in the 90s to give general oversight over our hospitals. Did you realize that, and I talked to some folks from that time frame when they actually put this in, that they were supposed to be minimally staffed, 10 to 20 people would be in the look at our VISNs. Right now, our VISN structure, with everything we've added on to it, instead of having that number, most of them have full-time staff between 60 and 100, but added staff of nearly 16,000 in the VISN structure. These are not also, some of them, by the way, some of them say, well, they're impacting healthcare because you have some doctors. I have one of my VISN directors actually tell me, they said, yes, we have some of ours who are, quote, dual-hatted. They do 4 hours a week in a clinic. That's not helping us with our veteran backlog. That's not helping with our wait times. It's still being done from a level that is far up. We have 200 plus call centers in the VA. You want to talk about that one for a second? These are, I mean, every one of our VBOs, our business have one of their own call centers for their mortgage issue. It's like, why do we have this? This is the part that has just grown over time, and it's not affecting healthcare. We're going to make it easier for a veteran to call one of these lines and get to talk to somebody on the other end of the line. But we're also going to make it to where we have people who are actually working in these our clinics, working in our disabilities, and working in our cemeteries that actually have firsthand touch. The last thing that I have to say is you can say what you want about where we're at and how we got here. But in 10 years, GAO has said we got a problem. We've increased money, we've increased spending. And by the way, before we get into it, someone will say, well, the PACT Act was why we had the money. Okay, you're right, but if you look at the numbers, we're basically giving some of the same money to the same people that were already there, just in a different capacity. And I respect that. They've earned it. As I have said before, I am a veteran who served under a burn pit for almost 5 months. So I think these are the areas that we've got to look at. But for anybody out there giving, and again, I go back to the assessment where you're cutting 15% of doctors, 15% of nurses, is frankly just not helpful to do what we need to do, because that's not what we're looking at. Frontline workers should be the happiest at the VA right now, because we're going to be freeing them up to do their job and not get bogged down with paperwork.
Absolutely, and I hope to see your CFO Senate confirmed very soon. You need that. You have a tough job right now ahead of you. I just want to thank you for your service to our nation's veterans, and I appreciate your laser-focused outcomes over optics. Now, please know that you have my full support in refocusing the VA on its founding principle, delivering the best care for those who bore in the battle. And with that, Chairman, I yield back.